Welcome back. My name is Heather Graham. Today we're talking side lying position. One of my absolute favorite positions. I actually do a lot more side lying position these days, in the last couple of years, than I've done in my entire career. Partly because I've been getting a lot more Thai massages lately, and in Thai massage, this side lying position is definitely used. So, one of the first things I like to do, again, keeping in mind that your client's shoulders and hips are stacked, their top leg can be bent, bottom leg is straight in this case, and I like to start with just palpating and finding that greater trochanter. So I've got the greater trochanter on him, is right here. Nice circular friction right around that greater trochanter will help you determine initially if there are any tender spots or trigger points around at the attachments here. Then you can work your way up and find the lateral iliac crest, and right between the greater trochanter and this lateral iliac crest there's this nice groove, and it really, you can take your stiff fingers in here and work it with some circular friction, or you can come down and with that proximal part of your forearm just gently come in there and sink right down into the middle, and with a footward pressure. So I'm sinking down into the table and towards the feet. And just giving a nice, firm compression. This helps create space in this area here and feels fantastic. And you can come back up and angle yourself in a little different position, coming a little more towards the back. And again, don't be afraid to hold these compressions 10, 15 seconds. That allows time for those muscles to release, and it just feels great. I can also come back and narrow my tools with my stiff fingers and sink down into these more meaty parts where the TFL and gluteus medius live, and I can palpate. And you can go through the sheet like this, or in the next video I will show you how to actually drape the back and access this whole back canvas from the side, from side lying position. If you do happen to feel a tight band, I've got a little something right here. It feels a little more congested and tight than the surrounding areas. Then I can palpate all the way up to the crest of the bone. I can palpate down, and I like to find about where the center of that band is, and then I can hold with some direct sustained compression. Again, 8, 10, 15 seconds. And then I can release for a moment. And I like to coordinate this with my client's breath. And as he exhales, I'm going to sink in again on that band with some nice firm pressure. The pressure should always be at a hurt so good level, never at a hurt so bad with the eyeballs popping and your clients holding their breath and in an extreme amount of pain. So again, I've lightened off that spot. I'm waiting for that next inhale. And then exhale, and I sink back in. And you might notice that each time you're sinking a little deeper and a little deeper as those muscle fibers do release. And again, I like to try to coordinate my breathing with my client as well. That helps bring both of us into coherence, and I feel it's more effective. So we called this the hip triangle in school. You've got your sacrum, you got your greater trochanter, and your iliac crest here. And in between, you've got a lot of muscles and a lot going on. So this is a really great way to treat hip issues. After we're finished, I like to just stretch those fibers back out.